Hello, my name is Annie Sherlock, and today I'm going to be presenting the other half of my preceptorship, which I did at Cornell University Veterinary Specialists. I did my 120 hours in the emergency critical care department. I rotated between taking triages in the emergency room to intermediate care and ICU. I plan to get my VTS in emergency after I get my license from the VTNE. They also have anesthesiology, cardiology, dentistry, dermatology, diagnostic imaging, internal medicine, and interventional radiology and interventional endoscopy, along with oncology, ophthalmology, and surgery. For my first case study, we had the emergency technician take a triage and get a history to state why the patient was here. So the front desk will call a triage, and then the technician would get on the phone with the owner. Since it's COVID, we don't have any of the owners come in. So we're doing mostly everything over the phone when it comes to talking with the owners. So for the history, there was a French bulldog that presented to a different animal hospital due to its neck and facial swelling. The owners decided to transfer it to Cornell University as the previous hospital they were at, they thought it was lymphoma. We then, when a triage comes in, we will take a TPR and wait for the doctor to come and examine it. So the temperature was 102.6 degrees Fahrenheit. The heart rate was 140 beats per minute. Respiratory rate was 28 per minute. The mucous membrane color was pink, and the capillary refill time was less than 2. Seeing this French bulldog come in, the face was really swollen. The neck was really swollen. I wanted to get a picture of it, but I didn't have the chance to. After getting the TPR, the doctor decided to perform a needle aspirate to see if it was lymphoma. She didn't notice any other things on the physical exam. The lymph nodes weren't swollen. So after she performed the needle aspirate, she received brown pus in the syringe. So we then concluded that it was an abscess. She also looked in the dog's mouth, and she didn't see anything, any sticks or anything to see how he could have gotten this abscess. So then we decided to come up with a plan. So after the veterinarian examines any animals during a triage, if it is something that is stable, of course we'll take our time. But if it is something that is unstable and we need stabilization, or we need permission for them to put in a catheter, or we just need a code, we will have one of our lead workers go in and talk to the owners and get the agreement to do so. But as for this situation, the dog was stable. So the veterinarian called the owners, explained to the owner that it was an abscess and it was not lymphoma, and decided that they would have to put the dog under anesthesia and insert a drain to drain out all of the pus. So then it would allow the swelling to go down. If they did not do that, then the face would still be swollen and it would just be uncomfortable for the dog. So the veterinarian goes over the risks of anesthesia. As for any animal, it doesn't even matter the age, there's always going to be a risk with anesthesia. But specifically for brachycephalic dogs, which a French bulldog, their face is more smushed, so they have a harder time breathing. So the owner went over, the risks that it could happen, and just wanted to make sure that they were okay with putting the dog under anesthesia. Of course, she explains how it will be monitored. No one is stepping away from it, and they'll do the best they can, but mistakes do happen. The owner agreed to follow up with the procedure. So as a technician, the emergency technician inserted a catheter, but before doing that, she shaved the area using clippers and cleaned it up with scrubs to make the area sterile. She then placed an IV catheter in his left cephalic vein using a 22 gauge needle and attached the T-port. We also, for Cornell University, their protocol is to attach a gauze on the top of the catheter to help it stay more stabilized, and it prevents the area from swelling. We also have to use gloves to keep it more sterile. And then once she attached the catheter, we drew blood from there just in case we wanted to send off any blood or just test any of the levels. And then next, we attached the leads for the ECG to measure the heart rate. And then next, the French Bulldog was pre-oxygenated for 5 minutes. So we just had the oxygen up to his face for 5 minutes before inserting the drugs to put him under anesthesia. The drugs that we used to put him under anesthesia is propofol. I've seen this used a lot. It works very well to put dogs under anesthesia when they're being fully monitored. So the important thing about propofol is you don't want to give it too fast, as you can put them into sleep apnea. So the tech inserted 2 milligrams of propofol along with methadone. Methadone is like a pain management. She inserted 3.5 milligrams of it with midazolam, which is also a sedative, but it can cause dysphoria. But when methadone and midazolam are working together, they tend to give it a little bit of a better flow. So then once the French Bulldog seemed to be sedated, we lubed his eyes and then intubated. So the assistant held his tongue out and his mouth, and then the technician used the laryngoscope to intubate with him. And then once she had him intubated, she put in a little bit more propofol, and the vet decided to do the procedure. The procedure considered her suturing the cheek and inserting a drain. So these were the drugs that were used. We have midazolam, methadone, propofol. A syringe pump was also used, along with fluids of P-lite and the sodium chloride, which was used to flush out the area that the drain was placed in, just to prevent infection. The important thing to do when using drugs is to make sure that your dose is right. Also make sure that it hasn't expired and that you have the right dose. So the technicians will double check with the veterinarians or another technician to make sure their math is correct. And it's also important that you remember the right route of administration that is given, because if you give it in a different one, it might not react as fast, or it could react too fast. So during the procedure, the veterinarian will continue the procedure. The assistant will begin to mark down each and chart what is coming from the monitoring machine, and also hold or help out with the veterinarian. And it is the technician's job to make sure that the dog is breathing properly. So before you sedate any animal, you want to make sure that all of the machines work. We had one machine that was dead, so we had to get one that worked before the dog was under sedation, because you don't want them to be sedated for too long. So the technician's job is to monitor the machine, check the heart rate, the respiratory rate, the temperature, mucous membranes, CRT, airway, most importantly, if it's breathing on its own, and the blood pressure. So it's important that the dog breathes on its own, and if it does not, you will need to manually give it breaths. If you see the right bottom picture, the black one is where you can manually give it a breath. So it should be taking 10 to 12 breaths per minute. Since this was a brachycephalic dog, he did do well under anesthesia, but he wasn't really taking his own breaths. So we had to, monitor him. To the top right picture, that's what a blood pressure cuff looks like. And then the bottom left is what EKG leads look like connected to a dog. And then basically to the top left is just everything that you should be monitoring and everything that should be connected to a dog while it is under anesthesia. You also want to check its reflexes to make sure that it's completely out. So overall, the procedure was about 45 minutes long. It took the veterinarian a little bit of some time to get the suture through, but once he was fine, and we waited for him to wake up and then extubated him. He was having a little bit of dysphoria due to the midazolam. It can make them feel a little bit out of place, so he was whining. We recovered him on the table and then decided to give him a reversal drug, which was fidazolam, which is the reversal drug of midazolam. And then once he was okay to go into a cage, we had our assistant do a full recovery on him and just monitor him to make sure that he was doing okay after being put under anesthesia. So again, the front desk called for a triage, and the technician that was my mentor has been on emergency for 15 years. So she handled getting the history over the phone. She was very good to work with. So the owner said that he appeared to be nauseous, vomited once this morning, was straining in the litter box, and did not urinate. The owner was wondering if the cat could be possibly constipated. He was eating and drinking normal and was not on any medications, but the owner did let us know that he does not like being at the vet, and that last time they had to fully sedate him to be examined. So once he came in, we couldn't even open the carrier without him trying to swat or hiss at us. So we had our assistant grab the gloves, and just the way that the carrier was, it was hard to even grab him. So we also used an e-collar to help prevent from biting, but the e-collar had gotten caught around his mouth, and then he didn't even want to be handled. So we had put him back in the carrier, and then our technician injected him to sedate him. Of course, with the permission from the owner. She had assumed that he would have to be sedated since he was for his last few exams. So we sedated him in the carrier, and once he didn't make any more noises, we realized that he was able to come out, and we put eye lube on him, and then we got the vitals from him. 102.9 degrees Fahrenheit was his temperature, 180 beats per minute was the pulse, and his respiratory rate was 40. Mucous membranes were pink, and less than 2. But also while getting the vitals, it's very important that you listen to the heart and the lungs. It's not just, collecting data. You also want to be able to hear different types of heart sounds in the lungs. If you hear a heart murmur or lungs, or notice anything about the patient, it could be helpful information to tell the doctor. So we decided that we weren't going to do full monitoring anesthesia because he wasn't going to be sedated for too long. But then the doctor examined him, and he was not constipated, but she did decide that we were going to give him an enema because just in case, to get the stool out, and his exam was normal. So this is what the triage sheet looks like. You write the vitals down, why he is here, and then the doctor will write the instructed what she wants to do with the patient. So once we decided to sedate the cat, then we drew blood from him to get a CBC, chemistry, PCV, blood gas, and a thyroid panel. We were also instructed to give Serenia 7.9 milligrams sub-Q and 120 milliliters sub-Q fluids because he seemed to be dehydrated. And we also wanted to get a urinalysis and his nails to be cut. We wanted to do everything possible while he was under sedation. So we definitely wanted to cut his nails so he wouldn't hurt anyone. He was sedated with alfaxylene, which I learned is a very good drug, especially when sedating a high fractious cat, along with midazolam, which aflaxylene and midazolam work very well together. He still seemed